Hi there, I'm Mr Shyamalan, consultant hand surgeon, and I'd like to do a patient educational video on wrist keyhole surgery or wrist arthroscopy.
Hi Mr Shyamalan, could you talk me through what would be the options then through keyhole surgery for the wrist?
Through any joint over the years, we've discovered in orthopedics we can start to put cameras and do things that normally we do through big open procedures through smaller ones. And the same with shoulder and the knee. In the wrist, over the last 20-30 years, the instrumentation has improved, so we can visualize the cartilage, the ligaments and the tendons with a lot more clarity, and therefore we can see conditions that usually we may have to treat through an open procedure through these tiny incisions. And we've got small shavers and burrs and we've got little cameras to take pictures for the patients. So they've given us so much more diagnostic information, but we can actually start to treat conditions as well.
So through any keyhole route, what would be the recovery?
So there are different groups of conditions that I treat, and it can be really all ages. From the simple soft tissue procedures like ganglions, which are soft tissue benign lumps, which you can get in the back of the wrist or you can get in the front of the wrist. And by putting the camera inside, you can visualize where the ganglion or the stalk of the ganglion comes from, and you can shave these through a shaver. And actually the recovery for them is very quick. Within a week you can take down the dressings and start to move the wrist. Now, if someone has more tears to ligaments, the first thing that keyhole does is allow us to assess where the tear is and whether it's repairable. And so if that tear is repairable, we can either put some stitches through keyhole in it, or we can shave the area that's torn to a smooth base. And the recovery from the shaving aspect of things is pretty quick. But if we decide there to repair it, then we have to stabilize, which basically protect the wound and protect the wrist with either a small cast initially and then change it to a plastic splint. Now, over the years, scaphoid surgery, which is one of the bigger bones in the wrist, have moved more to keyhole. And once again, we can assess the blood supply through the camera. We can shave the area of the damaged bone, and then we can even put in the patient's own bone through little portals, which is a small incision to feed in the bone graft. And we can use screws through X-ray image intensifier, through minimally invasive incisions. We can put in screws and wires. So actually that kind of procedure is slightly bigger, and therefore the rehabilitation is slightly longer. But I think the take-home message in keyhole surgery is its advantage. Its advantage, like all keyhole, it's minimally invasive, therefore less cutting means less tissue to heal, less swelling, less pain, therefore the recovery is quicker, and the blood supply to those areas that we're operating on are better because we haven't had to open up these areas. So in general, I found that keyhole surgery allows the recovery and the functional outcome therefore to be better, certainly in scaphoid surgeries or ligament tears and injuries and repairs. Arthritis is another group of patients where you can get in and you can assess the arthritic bone, assess the inflammation around this area by shaving the synovium, which is the cells that produce the fluid of the lubricant in the joint. Sometimes they get a bit inflamed. So by shaving them or removing bits of arthritic bone, sharp ends, which you can see, or tidying up bits of damaged ligament, that actually helps the wrist glide a bit better and stops that pain through catching or any areas that may be impinging or causing any pain. So I would say the vast amount of procedures now we can do through keyhole are really changing how people are presenting with wrist problems and what I'm offering. Obviously they would have tried physiotherapy and perhaps injections and other forms of treatments first, but keyhole is definitely a really good start.
And would there be any complications that we'd have to think about with keyhole surgery?
Whenever you're doing anything through minor incisions, you have to be mindful of damaging things, whether it's nerves, small vessels, tendons. And yes, there is literature where all these things have been damaged, but by expertise, actually the rate of complications is much lower. And I would say that actually probably the one where people would present the most is where that procedure perhaps hasn't worked, or perhaps after a period of time the symptoms may recur, as opposed to damaging a particular structure, which once again with expertise is much less.
Thank you.
Okay, thank you very much.